So this healthcare model, this Medicare Advantage model truly does put a premium on quality, and it incentivizes physicians and providers for keeping their patients healthy, which really is when any of you went to your professional schooling, you didn't tell your loved ones, you didn't tell them, I'm going to school to be a sick care provider. You said, I'm going to be a healthcare provider. And I can ask all of you, when do your patients come and see you? They come and see you not to get checkups. They usually cancel those annual wellness visits and those checkups. They only come and see you when they need some. And that's what the Medicare Advantage model tries to get rid of, and tries to incentivize everyone for seeing their physicians more often, incentivize physicians for seeing their patients more often. So how does this model work? How does Medicare Advantage or Medicare risk adjustment truly work? So as we know, there's over 70,000 ICD-10 codes in the AAPC's manuals, and those ICD-10 codes vary from heart failure, diastolic heart failure, congestive heart failure, peripheral vascular disease, atherosclerosis, major depressive disorder, and it even has some ICD-10s like bit by a Turk or issues with mother-in-law or issues with in-laws. So what CMS did, they analyzed all 70,000 of these ICD-10 codes. They put about 14,000 of them and said that they risk adjust, and they mapped those 14,000 into approximately 86 categories, and they call those categories HCC categories or hierarchical condition categories. These categories, 86 of them, are all made up of clinically related conditions. So what do I mean by that? Well, diabetes falls into category number 18. So diabetes with peripheral vascular disease falls into 18, as does diabetes with periodontal disease. They all fall into each different category. Heart failures and heart disease fall into one category. Mental disorders all fall into one category. And as patients have multiple chronic diseases, they can have diabetes with peripheral vascular disease, and they can have diabetes with periodontal disease, but you only get credit for one category per member per year. And we'll talk more about this in subsequent videos, and we will teach you all of these details and tell you which of the codes fall into them, which of the 14,000 fall into them. And we'll also tell you kind of what you need to do, what screenings you should do to identify these, and we'll kind of teach you this model as we go along.